Are you at risk for stroke? Know the early signs. Stroke is one of the leading causes of disability and death in the United States, and it's on the rise. While strokes are sometimes perceived as only affecting older people, there are plenty of young adults who also experience this condition, which occurs when blood flow to the brain stops due to clotting or burst blood vessels in the brain. High blood pressure, high cholesterol, and diabetes are factors that can increase your risk for stroke. Be aware of the following early signs of stroke so you can seek immediate treatment if you start to experience them. Stroke, a condition in which blood flow to the brain is interrupted, is one of the leading causes of death and disability in America today. Stroke rates are on the rise among all age groups, but millennials have been hit especially hard. In fact, they're more than twice as likely to experience a stroke than their parents were at this age. Stroke affects 1 in every 20 adults worldwide, and it's important that everyone know what to look out for so they can be proactive about prevention. What are the risk factors for stroke? Stroke is a leading cause of disability, second only to heart disease in the United States. Strokes are caused when blood flow to the brain is disrupted by clotting or bleeding, and they can lead to long-term disabilities or death if not treated immediately. The risk factors that have been identified with an increased likelihood of having a stroke include being over 45 years old, smoking, high blood pressure, diabetes, high cholesterol levels, obesity, and physical inactivity. Other risk factors that have been identified include mental illness, oral contraceptive use, and pregnancy. There are also other genetic disorders like homocystinuria, which put people at a higher risk of stroke. The most common symptom of stroke is sudden weakness or numbness on one side of the body. This may be accompanied by speech problems, trouble seeing out of one eye, dizziness or loss of balance, difficulty understanding what others are saying, severe headache, and vomiting. It is important to know these warning signs so that emergency medical attention can be sought as soon as possible. What are the early signs of stroke? The warning signs of a stroke depend on what area of the brain is affected. Strokes can affect your senses, emotions, and physical abilities in different ways depending on where in your brain it occurs. Here are some symptoms to watch out for. Sudden numbness or weakness of face, arm, or leg, especially on one side of body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes, especially if vision loss is sudden. Sudden dizziness, loss of balance, nausea. Severe headache with no known cause. Unusual changes in mood or behavior. When should you see a doctor? If you experience any of these warning signs, seek medical attention immediately. A drooping face on one side of your mouth or eye may indicate a weak facial nerve or impaired swallowing. One arm is weak or numb and difficult to lift up, may be a sign of a blockage in the artery that supplies blood to the brain in that side of your head. Loss of consciousness, even for a short period, and numbness are major concerns and should not be ignored. Other warning signs include difficulty walking, talking, or understanding what others are saying, dizziness when standing up quickly, headache with no obvious cause, sudden blindness in one eye, trouble remembering words or where you just were, slurred speech, inability to read because words are running together or reading too fast, difficulty speaking more than a few words at a time without pausing to think about what word will come next. Although strokes can happen to anyone, people with hypertension and diabetes are more likely to suffer from one. The 5 most common symptoms of a stroke are numbness or weakness in any part of your body, difficulty speaking or understanding speech, vision changes, including blurred vision or one-sided loss of vision, sudden severe headache, especially if pain is on only one side of your head, and unexplained dizziness, trouble walking, or loss of balance. These symptoms need to be checked out by a doctor immediately if they last more than a few minutes. These 5 lifestyles change you can make to avoid stroke. Strokes are one of the leading causes of death and disability in America today, and most people don't even realize that they're at risk until it's too late. While there's no way to completely prevent strokes from happening, there are certain changes you can make to your lifestyle to help reduce your stroke risk factors, as well as provide treatment after the stroke occurs. In this article, we go over 5 effective ways to avoid a stroke through lifestyle changes like quitting smoking and taking up exercise. 1. Get regular exercise. One of the simplest ways to reduce your risk for stroke is by staying active. Exercise strengthens your heart and reduces blood pressure, which in turn improves brain circulation. You don't have to work out all day long. Even 30 minutes of moderate activity each day will do the trick. Here are some ideas on how to get active without breaking a sweat too. Eat a healthy diet. It's important to have a diet high in potassium, calcium, and magnesium, and low in sodium. One way of doing this is by eating more fruits and vegetables. This will help maintain an appropriate fluid balance and keep the blood vessels flexible. Leafy greens, potatoes, beans, oranges, figs, and bananas are all good sources of these nutrients. Limit your intake of processed foods and animal products as they contain high levels of sodium. If you do eat meat, choose lean cuts that are lower in fat like chicken breast or turkey breast. 3. Quit smoking. Smoking is the #1 cause of stroke and also increases your risk for heart disease and many cancers. Smoking also causes chronic obstructive pulmonary disease, COPD, which includes bronchitis, emphysema, and chronic bronchiolitis. Tobacco smoke contains more than 7,000 chemicals, including 70 that are known to cause cancer. Exposure to secondhand smoke also raises the risk of stroke. If you're currently a smoker, talk with your doctor about getting help in quitting. 4. Limit your alcohol intake. Limit your alcohol intake because excess alcohol increases your chances of having a stroke. Alcohol also contributes to high blood pressure and hardening of the arteries, which are risk factors for stroke. To limit alcohol intake, drink in moderation and reduce the frequency of binge drinking or heavy drinking episodes. You should not drink more than 1 alcoholic beverage per day for women and 2 per day for men. 5. Control your blood pressure. There are many things you can do to help lower your blood pressure. You should focus on eating a healthy diet that is low in fat and salt, and stop smoking. You should also try to maintain an active lifestyle and exercise regularly by doing aerobic exercise for 30 minutes at least 3 times per week. Additionally, it is important that you keep your stress levels low as much as possible. Tips to avoid stroke. Stay physically active. Exercise is one of the best ways to reduce your risk of stroke. Limit sedentary activities and try to get at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise each week. 2. Don't smoke. Smoking increases your risk of having a stroke, so quit if you can. 3. Eat right. Eating healthy food helps your body stay strong and resistant against disease, including strokes. Focus on eating plenty of fruits and vegetables, whole grains, heart-healthy fats like omega-3 fatty acids, and protein with every meal. 4. Watch what you drink. Too much alcohol can lead to high blood pressure, which increases the risk for stroke in some people. So these should know how to prevent stroke and early signs to identify early signs of stroke in today's high-risk population. And that's it for today. If you found value throughout this video, make sure to subscribe to my channel and click the like button. See you in another video.